I'm at Sixth Street Veterinary Hospital talking to Dr. Michal Harris, aka Dr. Mike. Thank you for joining us.
I'm so happy to have you guys here so I can show you some of our new equipment.
I was about to say, this looks really cool and I want to know more about it.
Yeah, we're so excited. This is our CT machine.
Okay.
We've actually got it installed and had it almost a year now, so we're getting really good at getting images and helping out a lot of our patients.
Images that you would normally have to send out to get, but you have it right here.
Exactly. So, you know, CT is used for some of our more advanced cases. I think it's important when we can to always get an answer for you guys as pet parents and find out, okay, what is our diagnosis and therefore what are our options? What I found when I had to send my patients out to referral hospitals, specialty places in Jacksonville or Gainesville, they do an excellent job, but by the time people had a diagnosis, they'd spent so much money that they couldn't afford any kind of treatment or surgery to actually fix the problem. So that was when I started looking at what were the chances that we could just go ahead and do CTs here.
And so this doesn't just check bone, it checks soft tissue?
Exactly. It has a million uses, it feels like, you know. Anything that x-ray and ultrasound is really hard to see. So there might be problems with the joints, like looking at elbow joints for elbow dysplasia. We can look at the middle ear, we can look at the TMJ joints, we can look at tumors or masses in the thorax or abdomen. Actually, I have a really good example of a mass in the chest if you want to see it.
Of course.
One of the things that this particular machine is really good at is telling us a lot of information about vascularity. So this was a puppy dog named Catan. He was a lab.
Aww.
And in this image, he's laying on his side, okay, and we're kind of like looking through him. So this is his spine, and down here is his breastbone, his sternum. And all of these things you can see are the blood vessels going to his lungs and this big thing in the middle of his heart. Now, Catan, we could see on x-ray that he had a mass in the front of his chest that you're going to see here in a second. What we couldn't tell was, is that removable? And Catan was about 12 years old, you know, so what was important for his family to know is there a chance to remove this thing, and if so, you know, would that add a lot of time to his life? Would it be good quality time? So when we do this, the pets are asleep. They're under anesthesia because they have to not move, and I haven't gotten one of them to lay on the table and not move.
Exactly.
And we give them iodine contrast, which is the IV dye. You know, a lot of people have had that. And I'm going to show you what it lets us see. So I'm able to go through here, and as we come up right in the middle of Catan's chest, in front of his heart, coming into view, you can see this large mass. This ended up being a benign mass called a thymoma, and it was successfully removed by one of my colleagues in Tallahassee, and he did great. Catan did amazing. As far as I know, he's still living his best life. But one thing that you can see that we would never be able to see with x-ray is all of these blood vessels. You know, this is his aorta. These are the major blood vessels in his chest. And so the surgeons could really get a good look at, you know, where this thing is and whether or not it could actually be removed.
So you did mention sending patients out if you didn't have something like this, and that's going to cost a lot more. So what can people expect if they bring their animal here?
Of course, the cost depends. You know, it requires anesthesia, and then may or may not require giving a dye study, and also may or may not require having a radiologist read it. So, you know, a good broad range would be anywhere from $500 up to about $900, $950, something like that.
That's better than I was expecting.
Absolutely, yeah. And, you know, if you think that your pet might want a CT, I let people know, you know, get a consult with your vet. We would want to see your pet first before we would do CT because we're going to do anesthesia on them.
Right.
And sometimes there might be some extra testing needed before you do the CT, whether that be taking some chest x-rays, maybe we need to do blood work because of the anesthesia. But, you know, somewhere in that $500 to $900 range is going to get you where you want to be for CT, and in a very not invasive, you know, kind of way.
Yeah, so let's say they want to bring their pet that in? Where can they get more information?
So you can call us at Sixth Street Vet at 904-259-2200. Our Facebook is Sixth Street Vet, or our website is sixthstreetvet.com.
Well, thank you so much. I think this is so fascinating and obviously going to help a lot of people. So if you'd like to see this segment again or get more information, go to firstcoastliving.net.